Well, hi, everyone. I just wanted to come on and thank everyone who came to the presentation today and to re-record the presentation because there was some technical difficulties. So I wanted to make sure everyone had this information. So I'm going to record it again for us now and send it out as the replay. So thank you, everyone who came and attended live. And let's get started with this presentation. So hello, so this is Advancing Nurse Coaching, and we're going to talk about what is nurse coaching. So for everyone in the audience, sit back, relax, take a deep breath, and just enjoy the presentation, and I hope you learned something of value for you. So professional nurse coaches are registered nurses with additional training and expertise in coaching. We follow evidence-based practice and evidence-informed practice as the foundation of our coaching, which we can use also up to and to include the limits of our professional licensure and training. So we're able to practice to the top of our abilities. We help individuals and communities to reach their full health potential through the nurse coaching conversation, which empowers patients and nurses actually to bring our best selves to our profession and to be there to allow for our patients to have their own insights into their own health and to how to move forward no matter which stage of life that they're in. Nurse coaches are board certified by the American Holistic Nurses Credentialing Corporation, otherwise known as AHNCC. Their website, if you wanted to look it up, is ahncc.org. And their CEO is Margaret Erickson. She is a wealth of information. So if you have questions, you can obviously reach out to them at the AHNCC. But nurse coach board certification is magnet recognized and pathways recognized. We practice in all clinical settings in the community, the hospitals, critical care, private practice, anywhere that you are a nurse, you can use coaching. It's part of our skill set. It's what nurses do naturally, but nurse coaching as a board certification is shining a light really onto what nurses do. We've had a difficult time in the past trying to describe what nurses do, and we really truly bring a part of healing and health to people and give access to how to put a body into a state of health and tap into this innate ability to heal. We help patients in all stages of life, from chronic illness, aging, health maintenance, end of life, beginning of life. Anywhere a nurse can work, you can be a nurse coach. And nurse coaching, for me, it goes beyond just this coaching hat that we might put on, this ability to communicate with people, but we build relationships. We tap into this human resource of information and care and helping people to step into their own power of what do you need to do for yourself to take care of yourself. And we have so much, well, for so long we've been in a medical model or a sick care model that I think a lot of us have forgotten what it's like just to be healthy. Like the only time you would go to a doctor would be when you were sick. But with health anxiety and a lot of uncertainty in the world, I think the ideas have shifted. And there's a lot of people that even I talk to daily who are like, I want to take care of myself, but I don't really know how. Nurse coaching bridges that gap for us because we understand the client's health journey. We know what health and what illness looks like, and we also know what helps that. So we empower clients to take the reins of their own life's journey, their own health, and give them that person that's in their corner to help them to achieve their own goals. And it truly is the client's goals, not the nurse's goals. I know we know that, but I think it bears to talk about it occasionally. So what are nurse coaching skills? We are excellent listeners. We listen beyond the words. We ask questions that come to us that oftentimes lead us to answers that we didn't anticipate, or information that is helpful to us in our ability to help that patient navigate their health challenge or their next steps for what they would like to do. So we uncover insights. Those insights help that client gain clarity for their next steps. And knowing that insights really are the outcome of all coaching. Nothing ever happens until a person truly has insight into why they may or may not want to engage in certain health activities, or even engaging in their life. I recently went on a trip to France, and I came back with a new perspective, and I thought, wow, how did I not know? I thought I was being pretty good to myself. But in hindsight, looking back at that vacation and realizing there's a lot of people in this world who truly do live in the moment. They truly do appreciate where they live and what they have and the people that are around them. And that art of appreciation is also part of life. And I think even though intellectually we say we're taking care of ourselves, there is a deeper level of being able to really tap into that innate health, that innate wisdom, this ability to connect to life in a way that gives us a direction and clarity, and moving into this space of knowing and enjoying life. And we do that for our patients because we bring a presence with us. When a nurse walks into a room, or when a nurse interacts with other people, there's a presence that we bring, this feeling, or this expression of care that helps people to open up and maybe take a different look than they would normally at maybe their circumstance or even their illness. And we give hope. We show people how to navigate maybe in a way they've never considered before. So in that way, we walk beside, maybe a little behind, to support and witness their transformation. And we take our own personal opinions out of the way, because we know we can't live their life for them. We've always known that. But nurses are really good at taking on other people's cares and concerns, and sometimes we make them our own. And this firmly and solidly says, no, I'm here to support you so you can find your way. And at the same time, the nurse can actually see herself or himself and take the reins for themselves and begin this conversation, or this dance, if you will, of caring about people, not just for them, but about them as a human being. And we transform lives with that process. So then you might ask, well, what are the career opportunities for nurse coaches? The obvious one is in the hospitals. That's where most people think about nurses when we begin to say, where do we find nurses? In the hospitals is a great place for us to bring this coaching skill with us. It actually doesn't take any more time for us to coach. And as busy as the circumstances are in the hospitals now, we can have this coaching hat on, which I think gives us this internal shift, or this internal perspective of like, this isn't about me. I am here to do what I know how to do best, to put this person into a state of health, and then we just monitor. And I know I worked in PACU for many years, and I know how busy it can be, how exhausting it can be. I feel like when I became a nurse coach, it started saving me time because I didn't have so much noise going on in my head about all of the next things I have to do and the tiredness and the politics and, you know, how long am I going to have to be here? How many hours over do I need to stay? Any of those kinds of questions take up space in our mind. And I think this way of being as a nurse coach, and especially in the Advancing Nurse Coaching program, where we teach how our minds work, how resilience is always our default setting, gives us that opportunity to recognize when our minds get busy and then what to do. And in some cases, there is nothing to do but notice that, and you become present and focus in this moment. In some places, many nurses I know are owning their own coaching practice. They're finding a need in their community or in the people they want to serve, and they're building connections and networks of people and sharing what they do as a nurse, as a coach. And their people are ready. People are hearing it. Some people are doing what they call a reset. So they're doing a 7 or 10 day reset and just teaching people, you know, to take a look at what health is. It's not separate from our lives. It's us taking the reins to do those things that we know we should be doing, and to honoring the process and to slowing down to really become present to this life that we have. We only have so many years here in this physical realm. Make them the best you can make them. Pay attention to what's important to you and do that. Another place that people are working is case management. The insurance companies and hospitals have come on board with saying we need nurse coaches for the case management because there's something a little different, and they're beginning to notice that. Private businesses such as a construction company, car companies, they have a lot of employees. One of my friends has contracted with a construction company to be the nurse coach for their employees. They actually incorporated her services into their benefits package. And when it came time this last year for them to reevaluate if they wanted to keep that part of the benefits package, everyone at the table said yes. They're like, we'll cut somewhere else, but we're not cutting nurse coaching, because they see how beneficial it is for their employees and maintaining health, decreasing days off at work, and giving people another avenue to learn about health. So private businesses, insurance companies, all of those places are beginning to, very beginning, let me rephrase that, find out about nurse coaching. And the more of us that are nurse coaches and putting our services out there, the more the public becomes aware of what we're doing. I think it will be very commonplace in the near future. But truly, the possibilities are limitless. Wherever you can look at something and fill in a gap is a place for a nurse coach. So how do you get started? So to get started, first, of course, you must be a registered nurse with 2 years associate degree. You have to have, I think 4 years of experience. With a bachelor's, it's 2 years. Don't quote me on that. It's on the AHNCC website. I should have had that statistic. But you do have to have some experience. That does not preclude someone who is new to a brand new nurse. There's no time like the present to get started. This skill can happen anytime that you want, but just know that those are the requirements, and begin to get your CEs and see what happens for you. It's 60 hours of holistic CE and 60 hours of coaching practice, both of which Advancing Nurse Coaching provides for you to allow you to sit for the board certification. So again, here we offer the 60 hours of CE, 60 hours of supervised practice, and we are a 100% online self-paced course with rolling enrollment, which means you can start anytime. and you can take your time with the course. It is designed, if you so choose, to take it within 16 weeks. You would need 5 to 7 hours a week to complete the coursework, which 1.5 hours per week would be an online live class, so that you have that interaction and to see what other people are doing and how coaching is changing lives. We are a sponsored program by the American Holistic Nurse Credentialing Corporation. So if you look on the website, you'll see the list of nurse coaching schools that are current, and our name is the first one on the list. In our program is a little bit different than what you might expect from any of the other programs, because we only focus on one thing: resilience. We focus on how the mind works, because all things filter through that space. Our thinking affects our body. We know that stress is the leading cause of illness worldwide, and that's what we touch. We touch on how that works, what this connection means, and brings us back to living in the present moment. We learn through logic, which really tickles my nurse brain. I really love that. But it truly is insight that creates the ability to see something beyond the words. And it has deep meaning for us. It's like when you hear something that's true for the first time, you go, oh, hold on, what? And we listen a little better. And when the information is true for us, we actually take that in, and from that space, we make changes. It becomes our why, or it becomes this piece of us that's like, well, why am I looking over there if the answer is over here? That's what insight does for us. And realizing that you and your patients have this inherent capacity for health and well-being. It's our default state. Our default state is health. But in modern society, we've forgotten. We're always thinking about the next illness. All we have to do is watch the news and see how many new drugs are coming out. And, many of these drugs are designed for you to take for the rest of your life. While I'm not opposed to any medications, especially if you need them, I think beginning to really understand what health is a first step in healing, and really truly deciding what we need to do as our steps for becoming more healthy or maintaining our health. And this awareness, this innate health and resilience that's within us all, it appears every time we take a step. It's always here. It's when we begin to think that we're not resilient, or that something is really wrong, that we start holding ourselves back, and then feeling as if we've lost hope, or there's not hope for me, or any of those things that we would do to worry about what's going on with us. But when we can drop worry and self-criticism and really understand where that comes from, and this sense or this feeling of worry, maybe even insecurity or fear, it all comes from the same place. It's a thought-created world that is not separate from this physical reality that we see. We're creating it every moment of every day. And when we know that that's what's happening, things really begin to shift. They really do. They start to look different, we feel different, and we act different. So nurse coaching as an overall concept is something that every nurse has. We can all be nurse coaches. It's not a specialty, because if it was a specialty, it would be siloed into one specific area like critical care. But because it's a general skill that nurses can develop, or some of us have it naturally, some people just naturally know how to coach people or empower people, but we can always learn to do it better, because it actually improves collegiality. When we start knowing where we're coming from, and then we know where other people are coming from, we begin to treat each other different. We begin to speak to each other differently. We become less reactive. We empower our patients instead of, here, let me do it, I'll take over, just do as I say. We stop doing that. And when we do that, we give ourselves boundaries. We don't take on other people's pains and sorrows. While we can have empathy, we can empower our patient to know that they're perfectly okay on the journey they're on, and let them know that. That leads to better patient outcomes. When our patients feel better, they do better. And so then they, as an outcome, maybe of even just one conversation with a nurse coach, they become more accountable and engaged and more healthy clients. And it also improves our response ability through insight. We stop reacting so much. We might take that pause to respond with our ability to have insight into our circumstances, or maybe even what might be the next best thing to say to our client or the patient. Those conversations are different conversations than, here, do this, do this, do this. These are the 5 things to look out for. If this happens, call the doctor, blah, blah, blah. This is nursing. This is nurse. You can develop a nursing care plan as a coaching care plan and give it to the client. Let them make the changes on it. The changes that we're having and the transformations that we're seeing with people, individuals, is truly miraculous. When you empower someone to become engaged in their life, we automatically become more engaged in ours. It's a synergistic effect, and there is really nothing like it. So board certification through the HNCC website, you can become a double board certified nurse coach and holistic nurse. Now, this program only does the nurse coach program information. The holistic nurse is a separate book and a separate test, but the CEs that you receive through this program count for both. So hopefully I explained that well enough. If not, let me know. I'm happy to clarify. And beyond that, at Advancing Nurse Coaching, if you complete all 4 courses, C101, 2, 3, and 4, you can receive our Advancing Holistic Health Coach Certificate of Completion. And that lets people know that you've completed the highest training for learning how resilience works, how health works, and specifically with mental health. That's been a very hot topic. How do we get mental health in our society? And there's a lot of people out here who really truly care about the mental health of humanity. And this program addresses that in a very unique way and a very effective way. It's changing lives every day. So I really appreciate you being here and listening to this presentation, because there really is no time like the present. Indeed, it's all we've ever had. So I would invite you to connect with us. Check out our emails. If you would like to schedule a call, we would love to talk with you about your goals, your dreams. What would you like to do with nurse coaching? And invite you to connect with us. We are also the chapter co-leaders of the Austin area chapter of American Holistic Nurses. We usually meet monthly on Zoom. And it's a good place to come and just get to talk with us and meet like-minded nurses who are on a similar journey. So I would invite you to connect with us through our website, nursecoaching.com. Stay connected with us. We're happy to talk to anyone who is interested in learning more about our program, coaching, and just connecting with nurses like you. And thank you for being here, and thank you for listening to this presentation. Truly, truly appreciate everyone that's here. So thank you so much for taking the time to learn more about nurse coaching, and I look forward to seeing you.